Hello, everybody. My name is Adrian Owen. I am from the University of Western Ontario in Canada. Today, I'm going to talk about using fNIRS, functional near-infrared spectroscopy, to assess residual awareness in the ICU. Now, for the last couple of decades, my team here at Western, formerly Cambridge in the UK, have been developing tools to improve both diagnosis and prognosis in patients who have chronic disorders of consciousness, things like the vegetative state, minimally conscious state. On the diagnosis side, we've often used mental imagery, for example, imagining playing a game of tennis, to detect patients or to find patients who are behaviourally non-responsive, conscious, aware, but nevertheless unable to produce any voluntary actions. In these cases, some of these patients, about 20%, are able to produce mental actions, if you like, change the pattern of fMRI activity in their brains in response to command. More recently, we've used a simpler technique based on either viewing or listening to movie soundtracks. And we're able, by looking at the pattern of synchronization of brain activity across the entire cortex, we're able to detect that some patients, again around 20%, who appear to be entirely vegetative behaviourally, are actually responding to the plot of a movie in exactly the same way that a healthy participant might be expected to. On the prognosis side, we focused on a hierarchical approach, again developing various fMRI techniques to isolate sound perception, speech perception, and even language comprehension in some patients who behaviorally appear to be vegetative. And what we've shown is that how elaborate these fMRI responses are will determine the extent to which you will have any recovery 6 months from now. And that's irrespective of whether you're traumatic or non-traumatic brain injury, whether you're classed as vegetative state or minimally conscious. Those patients who show evidence of sound and speech perception and even speech comprehension are those who are most likely to show some signs of recovery. The other area where we and others have been working with this patient group is in just looking at simply resting state data, resting state fMRI. This is work from Loretta Norton, one of my colleagues at Western, showing intact resting state networks in patients who subsequently recovered versus those who did not. One of the more recent things we've been doing with this data is revisiting it using various machine learning techniques in the lab. And what we've shown is, by going back and looking at what's now 10-year-old resting state data, we can predict with 80% accuracy who is going to recover from, in this case, coma. More recently, we've been moving into the ICU to examine patients who typically are comatose and who are much more vulnerable than the chronic patients. They're not patients who are easily moved, and one of the real challenges here is getting them to the fMRI scanner. So to address this, we've been using fNIRS, functional near-infrared spectroscopy, which has some advantages in this population over fMRI. As anybody listening to this will know, it's sort of the optical equivalent of fMRI. It has pretty good spatial resolution and temporal resolution that's comparable to fMRI. But its main advantage in this context is its portability. As you can see from this diagram, we can really take it into the ICU. We put the cap on the patient without even having to move them from their bed. And that really gives us a real advantage, or gives this a real advantage relative to using fMRI. It also, of course, has much better spatial resolution than EEG, the other technique that is routinely used in the ICU with this population of patients. So the two questions that I'm going to really address today is, can fNIRS capture neural activity in these well-established fMRI paradigms that we developed recently to detect covert cortical processing? And I'm going to look at resting state, I'm going to look at our auditory hierarchy, and I'm also going to look at the command following. For the most part, we carry out these studies in exactly the same way as we published previously using fMRI, so I'm not going to go into great details about the methods. Let's start with resting state connectivity. Using fNIRS in healthy participants, we managed to identify many of the standard resting state networks that have been well established now with fMRI, including the sensorimotor network, the auditory network, the default mode network, and the frontoparietal network, which has been incredibly important for us to identify those patients who are aware versus those who are not. So I think fNIRS does very well as far as resting state connectivity is concerned. What about the auditory hierarchy? This is the task that separates sound perception, speech perception, and speech comprehension. Again, I won't go into details about exactly how the task works, but we compare listening to short stories versus listening to similar versions of those stories that are just involving pseudo words, so no comprehensible language, and white noise that we can do to detect simple sound perception in the brain. This is a technique that we and others have published previously using fMRI. What you can see here is a direct comparison between our fNIRS results in healthy participants and those from a study we conducted back in 2007 with Matt Davis and colleagues in Cambridge in the UK. And as you can see, really good agreement between the fNIRS results in both sound perception, in speech perception, even in language comprehension relative to those historic, if you like, fMRI results. So I think this clearly shows that you can use this hierarchical auditory or language paradigm in fNIRS to assess brain activity and potentially use it in a prognostication context, as we have done with fMRI. Another big one, motor imagery. I mean, can we detect people imagining playing tennis using fNIRS? And the answer is yes. As you can see here on the left-hand side, that's the group data. Motor imagery shows beautiful bilateral premotor activity in response to having people imagine playing tennis versus rest. On the right-hand side, you can just see one representative, the data from one representative participant there. Spatial navigation. I mean, the results don't look exactly the way the results look in fMRI, but we are managing to identify reliable activity in response to participants being asked to imagine moving around their house. And this is activity typically at the junction of the parietal and the occipital cortex. Of course, the big question then that remains is, can any of this be used to assess residual and covert awareness in unresponsive patients in the ICU? And we're still at very early days. This talk is really to introduce some of the new methods that we are trying. But here's data, for example, from a 78-year-old woman was recently in the ICU with encephalitis. She was tested 7 days post-admission. And as you can see, she produced very convincing responses in the sound perception task and in the speech perception task. That's her on the right and healthy controls on the left. And she was even able to complete the motor imagery tasks, to imagine playing tennis when we asked her to, generating this activity across the right premotor cortex, which is, again, exactly where we would expect it to be if she was actually aware, consciously aware, and able to generate these mental command following tasks. So where do we go from here? Well, I mentioned at the beginning of my talk, one of the other areas that we've been using in the chronic patients more and more is movie watching or listening to a movie narrative. And just give you a little bit more detail about that. Typically, we look at synchronization. We scan using fMRI, we would scan the patient for 7 or 8 minutes, in this case, listening to the audio track from the movie Taken. And we look at how well the brain synchronizes to the brains of healthy participants listening to the same segment of that movie. And what we're really interested in is the relationship between frontoparietal activity in the patients and frontoparietal activity in the healthy participants. And what my former postdoc, Lorena Nachi, has shown is that synchronization in frontoparietal cortex in patients with disorders of consciousness can be indicative, or is indicative, I should say, of residual or covert conscious awareness. So what about using a similar approach in the ICU? Well, we've been doing this. We've recently tested 11 patients. We're using machine learning, and this is work that one of my graduate students, Matthew Kolisnik, has been working on. He has developed a similarity index simply based on, and I should have said, this is using fNIRS data. So this is fNIRS having participants listening to the audio track from taken, and these are all patients that you're looking at here. And the point is that the similarity index really gives you an indication of how similar patients' overall cortical brain activity was whilst listening to taken to healthy participants. And one of the astonishing things is that some of these patients, remember these are all comatose patients in the ICU, are producing a similarity index of something close to 100%. They are indistinguishable, if you like, from healthy participants when following the narrative of a movie. We're at early stages, as I say, to determine whether this is going to be prognostically useful. There's certainly some emerging evidence that might be the case. So, for example, this patient that I've highlighted here actually went on very well and made a recovery. And at the time of the scan, despite being behaviourally non-responsive, they were producing their pattern of fNIRS activity when listening to the movie narrative was something like 80 to 90% similar to healthy participants. The final thing I want to say is about communication. And one thing we've done in the past in collaboration with Stephen Laurie's group, who's speaking in this symposium, is to adapt our fMRI motor imagery task to have patients with chronic disorders of consciousness actually communicating, generating yes and no responses by simply imagining playing tennis to indicate a yes and imagining moving around their house to convey a no. And this we've used successfully in a number of patients now to interrogate not only what they know about, in this case, their father's name, but also what their day-to-day preferences are, what TV shows they want to watch, what music they want to listen to, whether they're in pain, these sorts of things. The question we have now is could a similar technique be used to actually communicate with some covertly aware patients who appear to be behaviourally non-responsive in the ICU? I obviously wouldn't be telling you this if the answer wasn't yes. So this is data by another of my former postdocs, Andrew Abdelmalak. And Andrew showed simply using a version of the tennis imagery task. And if you ask patients to, and this is fNIRS data, imagine playing tennis, of course, you see this nice separation of oxy and deoxyhemoglobin. You can use that to determine if somebody is imagining playing tennis. And of course, you can then ask them to imagine playing tennis to signify a yes and just relax to signify a no. And this was early data from a patient that Andrew acquired, a patient who had Guillain-Barré syndrome. So it was entirely non-responsive in the ICU. They weren't sedated, and the clinical team at the time wanted us to establish, some days into this ordeal, whether the patient felt safe and was in any pain and wanted to continue in this situation. And the patient successfully responded to a series of questions. So, for example, are you in pain? Using fNIRS, the answer given was no, because the patient just continued to relax. We didn't see that canonical separation between the blue and red lines. In response to the do you feel safe, the patient answered yes. And I think we've now actually done this in 3 GBS patients successfully communicating. We have another paper just out by, again, my colleague Loretta Norton. So that's all I really wanted to say today. Of course, all this amazing work is done by other super smart people. Hopefully I've included everybody here. I've worked with many, many great people over the years, but I've included people that specifically contributed to the fNIRS work that I've emphasized today. So thanks very much for listening.